Hello again. I'm going to talk a little bit more about the opportunities in the Australian market and discuss some of the market entry considerations as well. Starting with just looking at the broader life sciences landscape in Australia, there's well over 2,600 organizations across the entire ecosystem. And the Australian life sciences industry segment in particular is dominated by the medical technologies and digital health companies. And that figure was around 600 in 2022. I guess these numbers change constantly, but just gives you an idea of the size of the industry. And apart from some major players like Cochlear, Alcidion, Telstra Health that you may have heard of, Australia's local medtech industry predominantly consists of small and medium-sized companies. A lot of them pre-revenue in the process of translating medical research into commercial products. I guess the scaling of innovation and commercialization is often very challenging in Australia, and it's sometimes taken offshore. I've also mentioned earlier that our domestic manufacturing capability is quite limited, and the market has been dominated by large US and European multinational companies that have a long-established presence in the region. We are a mature market for medical equipment, and due to limited domestic capacity and capability, we're dependent on imports and basically positioned at the end of a long and complex supply chain for most of the medical supplies. And a large share of medical products is imported from the United States and Europe. And again, looking at the broader life sciences ecosystem in Australia, East Coast is where most of the industry activity is based, and also the majority of the Australian population. Victoria and New South Wales are critical hubs of the life sciences industry, with more than 70% of the entire industry based in these two states, and mainly concentrated in the state capital cities, Sydney and Melbourne. We have a few major life sciences precincts or hubs, and those include the Melbourne Biomedical Precinct and the Westmead Health Precinct in Western Sydney. And there are, of course, other emerging life sciences hubs developing in other regions and cities, including Brisbane, and Gold Coast in Queensland, and Adelaide in South Australia. And now diving a little bit deeper into opportunities and areas of demand, Australia represents a growing market for medtech companies that are seeking to address significant national healthcare challenges and also capitalize on emerging trends. And as an example, Northern Irish companies offering solutions that can address the needs of an aging population, increasing burden of chronic diseases, challenges of remote and rural healthcare, will find significant potential in the market. There is a growing demand for a wide range of health and medical equipment and solutions. So, for example, we're talking about demand for home monitoring and chronic disease management, telehealth and mobile health solutions. We have also seen huge investment in new and upgraded hospital infrastructure, which is supporting demand for smart hospital technologies, improved patient management, hospital efficiency solutions, but also solutions that address healthcare workforce shortages, as an example. So we have automation and AI-driven solutions, as an example. And when we were completing research and preparing for this webinar, our office spoke with a number of stakeholders and key players about the medtech digital health solutions of interest in the market. And as an example, a major distributor of medtech has identified technologies that enable remote monitoring and home care as something that they're very interested in, as well as solutions in precision medicine and personalized care. And interestingly, in addition to clinical solutions, a procurement manager at a major aged care facility has also noted that they have huge interest when it comes to the operational or administrative side. So as an example, they highlighted software that would help track hours of care provided by clinical nurses as something that would be very useful for their organization. And similarly, systems that could help optimize or automate procurement would also be in demand, as that is typically a manual process that is managed by a nurse. A recent industry report has also highlighted 3 key areas of telehealth, remote patient monitoring, and virtual care as the most promising areas for transforming the Australian health system. And additionally, we have health analytics, AI, clinical decision supporting solutions that also have significant potential for data-driven healthcare solutions. And I also wanted to highlight a few recent trials in Australia that could also help sort of paint a picture of what technologies and solutions are being introduced in the Australian healthcare system. And I'll focus here on the first example on the screen. So following a successful trial or series of trials, an advanced cardiac care technology by a German medical device company was rolled out in Sydney in April last year. And this technology includes a cardiac monitor, defibrillator, and transmission platform, which allows paramedics, hospitals, and emergency departments to access real-time patient data. And some of the new capabilities on this communication platform include, as an example, in-app audio calling, messaging, and also image sharing. And all of this helps streamline patient information handover and also facilitates information sharing between paramedics, emergency workers, and doctors at the hospital. And this particular technology is hoping to improve communications for approximately 70 ambulance stations and around 12 hospitals across metropolitan Sydney. And the program is being delivered by eHealth New South Wales, which is New South Wales government's health agency, in partnership with New South Wales Ambulance, local health districts, and Device Technologies, which is the local partner for this German company. And I believe also that they're going to start implementing this particular platform in rural and remote areas in New South Wales. So now moving a little bit more into the digital health space, I thought it would be interesting to highlight an example of Medibank, which is Australia's largest private health insurance company with over 4 million customers nationwide. And last year, Medibank announced partnerships with 2 US digital health platform companies to provide personalized healthcare experiences for their customers, and also trying to integrate those virtual solutions with Medibank's health insurance membership. And as an example, Amplar Health, which is part of the Medibank group, has partnered with the US company Amwell to support the delivery of their new lifestyle management virtual app designed to promote wellness and also help prevent chronic disease amongst the patients. So Amwell is basically, and their automated care platform will provide Amplar Health customers with access to digital companion that will help guide the patients through their healthcare journey. And Amplar Health at the same time will also be a reseller of Amwell's automated care platform and also Silver Cloud digital mental health platform by the same company. And I wanted to also say a few things about AI digital tools. When it comes to AI, many Australian healthcare organizations are still in the early stages of understanding AI and how advanced analytics can benefit their operations. But we are seeing a significant proportion of providers that are in either planning or proof of concept stages when it comes to AI, and some have already implemented live use cases as well. It is important to mention, however, that the scale of adoption is still relatively small compared to other developed markets, particularly US and the UK, and there are certain challenges around the use of AI. I've highlighted 2 examples here and maybe just focus briefly on the second one. An American company, NetHealth, based in Pennsylvania. Their tissue analytics app was used in a trial with the Sydney Local Health District, which was trialing the app for use in hospital and remote settings, working with a local distributor, a company called Virtual Care, to help to integrate this app into Sydney Local Health District's electronic medical record platform. So based on the positive study and trial findings, the researchers recommended that this wound care app is rolled out across the entire health network. And similarly, Amplar Home Health, the company I mentioned previously with Medibank, has also introduced a tissue analytics platform to help improve and streamline their wound management for patients in their homes. Here we have a few examples of the UK health tech successfully introduced in Australia, and I'm sure the list is much longer, but I'd particularly like to highlight a Northern Irish company called Adoreboard. They offer AI tool for employee and customer experience management, and Adoreboard has successfully partnered with Australia's second largest private healthcare operator called Healthscope. I think they operate around 38 hospitals across Australia. And Adoreboard solution basically enables Healthscope to analyze patient surveys using AI, and that allows hospital executives to better understand and prioritize their patients' emotions and experiences. So quite an interesting collaboration. So just to briefly recap, that this is what you'll be thinking when you start thinking about the Australian market, this whole ecosystem of players and stakeholders. And as mentioned, we have our state and territory health departments, federal agencies, we have healthcare providers, hospitals, aged care in private and public setting, industry associations, NGOs such as Cancer Council of Australia, and of course, medtech companies like Device Technologies. So companies who may be a potential partner or may already be working with a company out of Northern Ireland. And of course, we have also a number of so-called peripheral players, growth centers, accelerators, health and medical research institutes, and as we have seen as well, private health insurance companies that also may be encouraging the uptake of innovative solutions. So the opportunities are definitely there, and the key thing for a Northern Irish company at this point will be to start thinking about your market entry strategy. And at a high level, your successful market journey will always start with understanding the Australian market, the ecosystem, understanding who your key customers and end users are, and I guess also thinking about where your product or technology fits in. And then looking at the regulatory side of things as well. So you may decide to engage with a regulatory consultant to advise you on the TGA requirements and what the relevant application procedure is for your particular product or technology. And when you think about the big picture, appointing a local partner in the Australian market will be absolutely critical. Distribution is generally an ideal market entry model, particularly valuable in the medtech and digital health space, given the importance of local knowledge and local networks. And you should be aware that generally distributors will be looking to partner with suppliers that can demonstrate successful track record, so case studies or testimonials from other key markets. But there's also others that will support niche and I guess novel technologies that they can certainly assist with introducing these to the healthcare community in Australia. In addition to partnering with local integrators or technology companies, you can also consider aligning yourselves with some of the other key stakeholders that we mentioned, such as cooperative research centers, organizations like Diabetes Australia, and there's certainly opportunities for collaboration, trials and pilots, which may be a good entry point into the market as well. Things you need to be aware of course, there is strong competition for attention and for funding. And also sometimes hospitals and clinics can be reluctant to change suppliers. But again, if you can demonstrate that you have a good track record in your market, and if you have case studies, that will increase your chances of success. So to summarize, understand the market, be aware of potential challenges. And I guess the final thing we always like to highlight is to get your feet on the ground. So Northern Irish companies should consider visiting Australia as soon as you've made enough connections. You can do it with the aim to connect with potential partners and customers, or to attend trade shows, industry events, conferences, and it will ideally be a combination of all of these things. And this is where Invest Northern Ireland and Foley can help you as well. So spending some time in the market will help you better understand the Australian context, help you build relationships and validate business opportunities. So I guess as the final thing maybe is to have a look at some of the major events we have in Australia. And obviously we're not Germany, so we don't have Medica or events of that scale, but we do have a few key events that will be of interest to Northern Irish companies, such as the Australian Healthcare Week, our AusMedTech conference, or Digital Health Festival as an example. Australian Healthcare Week is our largest and most comprehensive health event. It does include several different streams. I think for 2025 event, they have introduced something called Healthcare 2040, and that explores also the role of AI across diagnostics, predictive analytics, and also looks at surgical innovations, robotics, and some other areas. So with this slide, I'd like to conclude my presentation. I know there is a lot of information for you to digest. I wanted to thank you very much for the opportunity, and I'm looking forward to any questions after the webinar.